more of a taboo topic than even physician suicide. What happened with your license?
If you have ever provided medical advice to a person that's a friend of yours or a spouse, that violates your license.
Kind of a shocking statement. I've had patients and clients who were family members. I've actually done surgery on my ex for a mole, who was my husband at the time. I've been friends with lots of my patients. I've had students, so mentees, who end up being patients and who end up trying to then become friends. So then that's kind of a triple relationship. Research subjects, I haven't really done a ton of research other than doctor suicide cases, and so that doesn't really impact me so much, other than I have written like Petcoats and Pap smears of the book, where a lot of my patients have then become part of my book. I did get permission for that, but then that's patients who I then am publishing their stories. So that's a whole nother kind of like research subject. You need permission for that, but that's a dual relationship. Employees, I haven't really had any. I have had a business partner for many years, and I used to be her client or patient. And so this can get really muddy. There are 30 different variations or more that I've come up with here. Patients can be clients. Say you have a patient in your medical practice, then you open a coaching arm to your practice. Now you have a patient who's also a client. And how do you keep those separate without getting into trouble? You might have professional relationships with an attorney or CPA in town who's also your patient. If you are a gynecologist or an obstetrician in a small town, chances are you've delivered or done pap smears on most of the women in this small town. If you're a man, heterosexual, who are you going to date? Think about the crossover relationships that you have with people. And are you being clear in defining them? A lot of us are in more overlapping relationships than we care to acknowledge. And there's a reason why you should at least be cognizant of what these relationships are. If you are doing educating and teaching and in that emotional, spiritual zone with people, you're sort of in that counseling area. And in the counseling area, there are a lot more rules than if you were, say, in the surgical area or in the procedure area or just prescribing non-psychological meds. If your client is a minor, the professional needs to remember that the parents and the rest of the family are typically considered clients too, because they have to authorize the care. So, if you think about it that way, you have to understand, if you start to have a relationship with the parent of, say, a peds patient or client, and they become an employee, a business partner, a friend, that's also, if you've not thought about this, which I certainly had not, that's also going into the dual relationship category. So just notice. Also, if you employ a former client or his or her parents to engage in business dealings such as investment plans, or to the degree that the former client or their family believes, see, it's often a perception. If they believe, you could think that they're just a friend, but they could think you're acting as their doctor or somebody else, right, under a regulatory environment in which, if things go south, they could start to complain, and it could be worse than just a bad review online. They could get the medical board involved. They will believe and have trust in you because you are their physician or are a physician, whether you're their coach or whatever, they might perceive of you as their physician. And because of that trust in you as a professional, there's potential liability that wouldn't exist otherwise. In addition, a former client who is struggling and or dependent may expect continued employment from a former therapist or doctor. The issue here is not just legal liability, it's the potential for disappointment, frustration, anger, and even retroactively undoing the good work that's been done over all the years of your professional relationships. Really important if your dual relationship is with somebody who's mentally ill, especially personality disordered, borderline personality. I've got, some history with this and family members, and then it seems to seep into a lot of other areas of my life. Very important to notice this, because if you're dealing with somebody who has altered perceptions with their mental health and your relationship, it just gets more complex that way. And it's, again, about perceptions versus reality. You could even have a client contract, but if for some reason this person gloms onto you and loves you like a doctor and feels like you've been more helpful than any of their doctors, it's really important to keep redirecting them that you're just their facilitator for their peer support group, not their doctor, but you're willing to be their doctor if they would like to apply for a position in your practice. Also, terminating relationships, really important because of the emotionality. There could be instability, anger, there could be revenge, social media. Some people who are Facebook friends with you might think they're friends with you. I run into people all the time in town who think they're friends with me. I have no idea who they are, but they're friends with me on Facebook and they know me. If you were to develop a deeper relationship with them in some other context, just the overlap, what that means for you legally, what confusion can start. It all has to do with a power differential. If these people perceive you to have higher power, and if you do, in fact, have more power because you prescribed their meds, you've done their pap smears, you've delivered their babies, it creates an odd scenario that can become dangerous if you do not have the clarity and continue to not just one time have them sign a contract, but continue to have clear boundaries with them. This power differential can lead some people who are maybe less ethical or less able to manage these relationships, can lead them into areas of exploitation, emotional dependency, therapeutic deception, coercion, and manipulation. This is why the medical board and the psychological boards, health professional boards get involved with us when we create these relationships, because this power differential, especially if it's a minor, or especially if it's somebody that you're treating for mental health issues, including even behavior change. It's a gray area where you start getting into helping people with behaviors, perceptions and about themselves in the world, self-esteem, all sorts of ways that you're interacting with people that can go into this counseling psychotherapeutic realm. You just want to notice that. I'm going to replay the clip that I played before and a little bit more because I think it's relevant.
If you have ever provided medical advice to a person that's a friend of yours or a spouse, that violates your license. And I didn't know that. When I was going through one of my many divorces, and I decided marriage wasn't for me, I wound up in a relationship with a person or woman that had worked for me as a medical assistant. And we wound up living together for, 7 years. But in the middle of this divorce, my ex reported me to the board for having an inappropriate relationship with a patient.
Who was your MA?
Who was my MA, yeah.
Right.
And
Who
so
you ended up with for 7 years, but you were reported for that.
I was reported for that relationship. I'd actually followed the rules because I told her, I said, if we're going to date, I can't be your doctor. So I terminated that relationship. I even actually put a letter in her chart that as of such and such a date, I can no longer be your physician. So I follow the rules, but the medical board didn't care about that.
So you had 3 relationships. You had an employer relationship, a physician relationship, and then an intimate relationship with this woman. Is that true?
Yeah.
Every state is different. Correct me if I'm wrong. If you were to start a relationship with a patient or employee or something like that, you have to wait 2 years after to start the relationship. There has to be some sort of period of waiting, I guess.
This had been probably a year. And what I did was I kind of anonymously called the executive director of the board. I think I'm getting involved with this person. What do I legally have to do so I don't get in trouble? The executive director told me, well, all you got to do is terminate the relationship, make that statement. And then I said, then how long do you have to wait? And he goes, you don't. You can terminate the relationship as a physician or an employer, and the next day you could date them.
Did you get that in writing?
No, I didn't get that in writing. I got that from a phone call.
If you have a romantic relationship, is there a waiting period? Do you guys know? It can happen. All right. Especially in a small town, especially where your social circle is small, especially if you're a workaholic and all of your relationships pretty much center around your 100-hour work week that's in your office. Office staff sort of becomes like family. Have you ever felt that way, especially in residence? You don't really get to see your family, or workmates sort of feel like your family now. And so who are you going to date? You might date a colleague. You might date an employee who maybe you've prescribed meds for a migraine once. Many post-termination sexual relationships have occurred in situations where there was no real termination. Many times there's been a quickie termination designed to legitimize the transition to a romantic or sexual relationship. I was just sort of guessing 2 years. I really have no idea. I thought there was a waiting period. If you were to develop or want to date one of your patients under the medical regulatory board or nursing board if you're an NP, right? Is there a waiting period after termination of a patient relationship? And if there is, how long do you think it is? Just write in the chat. There's differences between specialties too. I didn't realize that. This seems to never get discussed because it's such a, again, taboo topic. The Wisconsin Medical Board, as of December 2002, adopted a rule that prohibits sex with a patient during the 2 years following the last professional contact. And this applies to all physicians, not just psychiatrists. I actually wrote the Oregon Medical Board 2 days ago to try to find out what sexual misconduct would be in Oregon. And this is the response I got. Hello, Dr. Weibel. After consulting my colleagues, it appears there is not a simple answer other than for psychologists. There should never be anything other than a professional relationship for psychologists. Outside of that, I'm told it depends on the discipline and the circumstances of each case. Also, other boards such as the Dental Board, Board of Nursing, etc., have their own guidelines, policies, and procedures. I hope that's helpful. That was helpful insofar as it was not helpful. There are no guidelines, which makes it very confusing because you can see how easily you could get snagged up in the subjectiveness of not really having any guidelines. There's no guideline other than if you're a psychiatrist or psychologist, probably never. Other than that, this is just actually more concerning that there's no more details than this, okay? And you know what? If I were contemplating having a sexual relationship with a patient, who I would certainly sever the doctor-patient relationship before doing that, I would probably be really nervous to even send this email to the Oregon Medical Board, only because I've retired my medical license that I think I felt safe enough to even write this email. Big brother thing on your back. It's really annoying. I don't know. Does that resonate with anyone? Would you feel comfortable even asking this question of your medical board? This is how difficult this conversation can be. The AMA standard and the general standard of care in the U.S. for a non-psychiatric physician-patient relationship. So this requires a discussion with the patient about implications that they can't then become a patient again. They can't have both a doctor and a lover, and they need to terminate the professional relationship and be referred to another physician. And although not explicitly stated, cancellation of all medication prescriptions and having them rewritten by a new physician is advisable, since physicians are generally prohibited from writing prescriptions for persons who are not their patients. There are a number of cases where charges have been brought of sex with a client just due to the fact that the physician has written several prescriptions for a former client after care was terminated. This will become more relevant as we go into our Q&A. The reality of an intimate relationship with a former client, no matter what the circumstances, is that the complaint may be filed with a licensure board by a former partner or spouse of either party. You're having a relationship with Mary, who was your MA, and maybe somebody that you did a pap smear on years ago. Their previous boyfriend or spouse, or your previous spouse or girlfriend, has to get pissed off enough to want to report you, which is not hard to do. People do seem to have revenge in their system at the end of a relationship. And so there you go. Now you're turned in by a previous partner, a jilted lover. It's not really fair, especially that we're not discussing this openly. So we don't even know what the rules are. So it's really easy to get in trouble. I definitely recommend have a contract, not only to protect your patient, but to protect you. And I mean having a patient contract, having a client contract if you're doing coaching, having an employment contract if you have somebody like a neighbor that's doing part-time phone receptionist stuff for you. Have a business partner contract if somebody that used to have a dual relationship with is now your business partner. Have a prenuptial or some sort of contract with a lover. And with family members, you really need to follow boundaries. And I'm just going to give some examples. My mom is a retired psychiatrist, and she has over and over again pressured me, and I've relented, to prescribe her blood pressure medicine, her eye drops. Even somebody in our trauma recovery group this morning says her family members, her mom has pressured her, and she's relented into prescribing meds. When you start prescribing meds, no matter what they are, for family members, it's a problem. You could be turned in by a pharmacist. It could really undermine your license. You need to let your family members know that, no, you're not going to give medical advice or prescribe to them. By me doing this, I ended up having a lot of turmoil with my mom, but in the end, it was much better for me not to be her doctor and just to be her daughter. You want to have a patient contract and a client contract so that people know whether they are your patient or your client. I have rules like no refills outside of visits, 30 to 60-minute visits. I have all sorts of rules on payments. And I don't budge on those for friends. So if I have friends that are patients, I treat them like there's no such thing as like being a VIP patient of mine. Everyone gets treated the same way. Being clear is so important for a number of reasons, including the fact that if anyone is confused, a potential patient or client will choose another professional, or they might get frustrated and angry and litigious with you. And that could be a whole nother issue. When does your patient-physician relationship start and how long does it last? It starts when you give advice or answer a question for somebody, directly giving them medical advice. And what's crazy about this, I'll share in just a minute, but I want to share when it ends. It ends usually in every state with a 30-day notice, and you have to follow state regulations for that. But I think, look at when this starts. You could be starting a patient-physician relationship with a neighbor in a grocery store parking lot when they ask you about a sore throat or something. Like that's all it takes for them to then perceive that they got medical advice from you, which they did. If you tell them even Elevate, Ice, if you're giving them recommendations for their sprained ankle in a parking lot or chest pain or whatever it is, you're now their physician. It's super important to recognize this. Or even a great aunt at a family reunion. You give them advice, you recommend a med for them, you maybe call in a med for them, who knows? That's starting a patient relationship with a family member, which if you have the same last name, a pharmacist can turn you in to the medical board. And it just is a bad idea. So in general, I recommend that you don't do any soap note type stuff with anyone that's not like in your office or having an actual session with you, a house call or whatever it is, and that you don't go into soap note territory with clients because they'll think that you're their doctor. I mean, it's just really important to have clear boundaries, I would say. Because if again, this is where there's problems. If you're in a small town, you've probably already been everyone's doctor. So you've got to have better boundaries in a small town. If you're a people pleaser and like you say yes to everyone who's hurting and you take in all the stray dogs and stray people and have a heart of gold for people, this can get you into trouble. There's a physician, I don't know if he's on our call tonight, but he got into some crazy trouble because he let a previous employee live at his house in a spare room for a while. Now you've got a house guest who was an employee who might have even been a patient. I mean, it can just, because people get down on their luck financially, you want to help them out, but just remember, helping them out without boundaries can get you into trouble. If you're a workaholic, like I said before, probably all of your relationships, especially around residency, med school, high pressure specialties like orthopedic surgeons, like most of your life will be at work. You're going to be working ungodly number of hours. You're going to start to have deeper relationships with employees. I did a session for an orthopedic surgery group after they lost 2 orthopedic surgeons who died within 6 weeks of each other. When I went there to do this grief workshop, I had some of the female employees that work at the front desk. I mean, they were just crying their eyes out because they actually said they considered these guys like their fathers, that's the type of relationship they had with these male doctors. These young female staff considered this clinic like their safe place and the place that they, these were like father figures to them. This is, again, it's a perception. It's really important for you to understand the perception that your employees have with you. You've got to follow clear relationship initiation and termination procedures. You could get into criminal, civil, even malpractice issues. And some of these medical liability policies, they don't cover breaking sexual boundaries. So you'd have to pay for that out of pocket. Okay, that would be it's very expensive too, fighting the medical board on all this. So anyway, a few other things that I'd like to share on this is if you start talking to a previous patient in any sort of counseling realm, they may consider that therapy again, and that angry former client can easily claim that that was a continued professional relationship carried on outside of regular office hours. What is the definition of sexual misconduct? And it can be anything from physical, verbal, written, interactive, electronic communication. Oh gosh, which is then you start thinking about Facebook and Instagram, which is why you should probably keep those private unless you have really good boundaries. Anything that's demeaning or harassing to the client. So it's pretty broad, and I think it's just worth understanding what these behaviors are. And what some people would think isn't sexual, other people would think is sexual. The cover of my Pet Goats and Pap Smears book seems kind of sexual to some people, although to me it's just sort of a whimsical little book cover. But my mom told me once if a male doctor had written my book and had that book cover, he probably would have lost his license. If you're a male doctor, chaperone with female patients versus a female doctor, level of nervousness with chaperones or not with male patients. These are all different things to consider. This I found really interesting. If non-psychiatric physicians are engaged in psychotherapy or counseling related to emotional issues, the psychiatric standards are recommended by the American Medical Association. So the family practitioner, pediatrician, or even the surgeon who engages in counseling and diagnosis of depression, for example, would do well to keep this in mind. In Wisconsin, the law there is about a 2-year waiting period for all physicians. Sometimes boundary violations are culminations of a series of smaller boundary crossings. So just it might not be one big thing that you do, but a series of things that you end up saying or doing for people over the years. A lot of physicians who've gotten in trouble with exes who are out to get them, who have a lot of revenge in their flowing through their blood stream, and then get these physicians caught up in all sorts of regulatory nightmares that otherwise would not have been an issue.
That's exactly right. That's what happened to me. And one of the stupidest decision I made through the whole thing, I should have just had a hearing, is one of the board guys said, well, would you be willing to go to a psychologic evaluation place? And that's where they get you. So you wind up saying, well, yeah, I'm as sane as can be. I'll go down and talk to these psychologists and I'll be fine. Wrong.
Then you're basically stuck in a web you can't get out of, right?
That's right. Thinking I was going to be there for about 3 weeks or something, and wound up being 3 months. Cost me a boatload of money.
Was that through the Physicians Health Program?
Yes, it was.
Yeah, on the entrance ramp to these sorts of things, they promise you, the program director, the hospital administrator, whomever will promise you like, oh, just, a precaution or just a day or two or just a few hours, right? And then you can't get out of it for 5 years.
That's right. They give you a discharge diagnosis, and I'm going to tell you right now, Pamela, I went in there and came out the same exact person. I just learned the lingo so I could get out of there. What I got from going to treatment for 3 months was PTSD. That's what I got. PHPs,
I think you all know that I talk quite a bit about this, but you can get referred to a physician's health program for virtually any reason. They encourage third-party referrals, so aggrieved spouses, jilted lovers, market competitors have all successfully required PHP evaluation of physicians. That's why it's really good to have clear boundaries. It only takes one pissed off person. If you haven't read my physician-friendly states for mental health review of medical boards, it's the only peer-reviewed journal article I've ever written in my life. Look it up. It will review your state and give you lots of examples of ways that people have been mistreated. I think physicians have been mistreated, treated as less than human, had our due process and our rights violated, how we get caught up in these for-profit health programs. You would think based on the title are there to help us, but often kind of ensnarl us in 5 years of what turns out to be a nightmare for some people. There's 33 doctors on my suicide registry who died by suicide under the care of these physician health programs. You want to avoid going in that direction if you can by understanding, and this is so true here, this is a quote from that peer review piece, physicians are treated as criminals and tracked more closely than level 3 sex offenders, reports a general surgeon. Answering all these questions on applications, all the mental health questions, the subtle unspoken lesson is you'd better be squeaky clean mentally, morally, and physically. If you step off the shining path, bad things will occur. I've known 7 male physicians who've died by suicide, most with a happy exterior. Why? They can't confide in colleagues for fear that their colleagues will turn them into hospitals and medical boards, and there goes their privileges and livelihood. They cannot confide in their spouses because during rough patches mentally, their marriages are already in trouble. If they share psychological problems, they probably fear that their wife may use it as ammunition in any future divorce, so they keep smiling right up to the hour they die. When is it that you gave up your license?
I let it expire. I didn't give it up. It was May of 2018. I just didn't re-up it.
Pay the fee. I wanted to retire my license October of last year, and I wrote and requested to retire my license. They asked me, "Are you sure you don't want to just inactivate it?" No, I would like to retire it. I'm effective on October 1st, and they wouldn't retire it until I didn't pay my dues. So it was December 31st of last year, and I have been very happy since. This is awesome. I feel so liberated to say and do whatever I want. I feel totally uncensored, which I felt before, but before I would have probably hesitated to say, yes, I will on occasion help somebody with psychedelics. You can't really say that out loud, right? If you have a medical license. So I can really say whatever I want because I am a healer and I'm not being monitored by anyone, which is awesome. Yeah, it's amazing. This is the last slide, and I think the really important take-home message for today before we do Q&A is that if you're going to be in a dual relationship, then be proactive about solving any future frustrations by these 3 things that I think all of us should do. Number 1 is message clarity. If you attract your ideal or super ideal clients because you have a very clear message about who you treat and under what circumstances and who you want to care for, then you can avoid taking on what would be non-ideal clients or patients for you. Non-ideal clients or patients are a setup for disaster. So the more clear you are about who you want to treat, like women over 50 with heart disease in a coaching peer support group, or, I do trauma recovery for physicians and it's a peer support group. And so these are clients and they are helping each other, and I'm just facilitating their sharing of their confidential traumatic experiences that they've had as physicians with each other. If you have ideal clients and they're there for the right reason, you're less likely to run into frustration. Avoid non-ideal clients and realize that that's not discrimination. Your non-ideal client is somebody else's ideal client. Number 2 is contract adherence. And what I mean by that is when you write a contract out for a patient, the person that's most likely to breach the contract is you. Like we will, as people pleasers, often will just give people special favors if they beg hard enough. Like, I really want you all to adhere to your contracts, because if you adhere to your contract, then you're setting yourself up for success with the patient or client or employee or business partner. Boundary compliance. Just understand personally what your boundaries are. Write them down, your general boundaries with relationships, with family members. Again, similar to number 2, you're at high risk of non-compliance with your boundaries. And when you do that, you set up circumstances where people get confused about their relationships with you, and they can end up in anger, frustration, litigation, all sorts of issues.